All right. Hey, everybody. This is Dr. Barnes and Dr. V. Hello there. So what this is hopefully for your entertainment and also education. We are really striving, as an office to increase just our education and really value for you guys as our patients. And so we're going to be bringing testimonials. We're going to be bringing nutrition studies and just things you can learn more about your health that you probably won't get other places. And we thought the best place to start would be really focusing on how to get the most out of your care as a patient in our office, really get the most bang for your buck. And so this will apply to, of course, newer patients, but also apply, just as strongly to our long-term patients as well. So, Dr. V, long time no see.
Long time no see. Like 5 minutes ago.
Yeah. So, if you want to maybe just kind of start with, what we're going to go through is the actual adjustment process in our office. So, you guys know it as like wobble, adjustment, vibe. The technical term for that is called mix, fix, and set. So we'll start with the wobble process. You want to just kind of walk through and start going off like what the benefits of that are, why we have, and we want every single person to do it, not only in the office but at home too.
Yeah. Well, to start with, we want every single person to do it because every single person has a spine. And that is what the wobble cushion is used for.
Exactly.
Your spine, yes, ready for the adjustment, but in between each vertebrae is a nice, juicy disc. And I wish I had a model here. Maybe you can pull one up while I'm talking. Have one? Oh, looky here. Cool. So you can see the spine has a lot of vertebrae and a lot of discs, and it's actually really hard to move every single one of those discs every day. That is why the wobble cushion exercises were designed to really get in there and move the disc. And moving the disc is important because that is the only way that our discs stay healthy. That is how they get nutrients in and toxins out, is through motion.
Yeah. Yeah, one of the things that I think I know when going back way back into learning about spinal anatomy, that kind of surprised me was how little blood supply there is to their discs. Very, very, very little. So whereas all the muscles in your body, the organs of your body, of course, have large amounts of blood flow, right, to bring nutrients into them. Your discs have very small amounts, which is why they rely, you're right, on that motion. But the consequence of that is, because of course we were designed to move, the consequence of that is if we're not moving, or in specific our spine is not moving, you really get the discs dehydrating, but ultimately that's like leads to degeneration. So that's when we see, I have my models right in front of me, so this is good. That's why when we see like a normal spinal model, which would have a big fat disc in there, get to something like this, well, that happens by lack of proper motion, in your spine. So now you can't necessarily, right, prevent injuries, but 100, 200 years ago, people were, moving all day long, right, for their job and just for their life. Their lives depended on it. But now, you can kind of go your entire life without moving, and so unfortunately, that's where we do see the consequences, of that.
Yeah. And then show too just the nerve exiting on the side of why that's important and how it actually relates to your nervous system.
Right. So you can see there's a big space right here because that disc kind of props that open. Okay, big space. But when that disc starts to collapse, there's less room. So that's where you start getting, impingement on the nerves and really degradation. I know one of the things I always try to highlight with patients, no matter what age they are, is that the spine is not meant to degenerate. It's not meant to break down. If once we die, if you don't get cremated, you can dig your bones up 500 years later and they're going to be in there. So I always have to try to communicate with people that if your bones are literally breaking down inside of your body while you're alive, you have to think about that there's something very wrong, going in there. So obviously it's reason number 925 to get adjusted to. But do you want to talk about the degeneration study, and also just speak, since we're talking about degeneration right now, do you want to talk about the degeneration study and why we recommend the frequencies of care that we do too?
Yeah. So I actually had this question in the Bay I think it was last week, I had a patient ask, why, like how the dentist, you go every 6 months to get your teeth cleaned. That's their recommendation based on their research for how long you can go without, having dental care and before you start developing cavities and all sorts of issues. And they were like, for chiropractic, like, what's like y'all's golden rule? What's the standard? And I was like, well, the research shows that after 2 weeks, your spine starts degenerating. So if you are not getting adjusted, getting the proper mobility, moving it properly, the flexibility, your range of motion, all of that will start breaking down. So every time you get an adjustment, even if you're not in pain, you are preventing your body from degenerating. You are preventing your body from years of pain and suffering with arthritis. But that is every 2 weeks. And we know, we talk in our office all the time about seasons. We understand that that's not always something that's plausible. We want to be your chiropractors for the rest of your lives, but we understand that there are going to be seasons in your life where you're not able to come in every 2 weeks.
Mhm.
But that's the amazing thing about chiropractic care, is that your body is always adapting. So as long as you are coming in, making up for that period of time at a different season of life when maybe things aren't so crazy busy with kids and stuff, then you will be able to get it back on track.
Well, and I want to add to that, the going to the dentist every 6 months. I mean, those recommendations are also based on the assumption that you are at a bare minimum brushing your teeth multiple times a day, you
Flossing.
flossing, right? And then you've been doing that your entire life.
Mhm.
So obviously, if you were 50 years old and you'd never been to a dentist before, never, brushed and flossed your teeth, you probably won't have any teeth left. But let's just say you do. If you did, they would be in terrible shape. So my guess is that your dental regimen would not start at, oh, come now and we'll see you in 6 months. There would probably have to be a lot of heavy duty lifting and aggressive, work, being done at you at that time. So one of the challenges are, of course, just people not being as aware of the importance of spinal care, chiropractic care, until maybe they find an office like ours. You might be 30, 40, 50, 60, or 70 years old before you finally knew what was going on in your spine. And now we're trying to really make up for lost time too. So while there is seasons where, yeah, things aren't as convenient, I think what we always try to stress is that it's like you probably don't have as much grace as you would with your teeth. Like most people could probably go a little bit before they have like a cavity. But if you're starting at a deficit with anyways, if you're starting with a deficit on your teeth, you're going to have more challenges, there too. But yeah, like we don't just, make recommendations up out of nowhere, for this. It's like there really is criticalness. And if you don't want to have a body that's breaking down when you're 50, 60, 70, or 80 years old, you got to put the work in, obviously.
Yeah,
Um,
that's so true. Talking about like your starting points.
yeah.
Yeah.
So, so kind of to summarize, right, the wobble exercises are, well, they look simple. They are extremely powerful for the overall health of your spine and your body, and really are necessary if you don't want to have degeneration and breakdown of your joints. So obviously you do
But
that
they have a
first.
wall cushion.
What's that?
And that's why they have one, right? It's
Exactly.
like you don't have to just do them before an adjustment. A wobble cushion is amazing for your body at any point in time.
Just like
Every
you're
day,
just like
all
you're
day.
not just like you're not just brushing your teeth the morning before you go to the dentist, right?
Exactly,
So
exactly.
you do them in between. And for most of you, of course, you have sitting jobs too. So, if you struggle to find time to fit in wobble, like you get home, maybe you're tired, you had a long day. Why not just have the wobble cushion at your office and do it, because you're already sitting on your butt for 8 hours a day, right? Just have it at a place where it's just very convenient and easy to use versus like try to make it be this extra thing that you have to do. And in reality, if you're sitting on that throughout the day, you're going to get some movement in there. It's going to be good for your core because you have to use your core a little bit when you're sitting on that. So that could be another tip for some people to incorporate it in, regularly, is to use it that way. Okay. So next up then is, of course, I'm biased, but it's my favorite part of the whole process, which is the adjustment itself. Um, and I know for me, like my first experience with chiropractic was really um, only on the understanding. Like I went in, I had a kink in my neck from playing basketball. So my like first understanding of chiropractic, just as a patient, because my doctor that I went to, he's a great guy, but he never like really educated me. So I only knew of chiropractic as sort of this like thing to like loosen up joints and like get my neck moving it again. But I know when I remember when I went to school and really started learning, like it's actually more about the nervous system, and that we're even knowing now it's even more about the brain. The brain adjustments are more for the health of your brain, and then your nervous system, and then your spine. Really, I feel like the value shoots up far past just getting.
Action now.
We got a third speaker now. Yeah.
He's gonna give his input in a second.
That's right. So, yeah, I mean, do you have any kind of similar thoughts on just like sort of what your, sort of evolution of learning about what the value of an adjustment was, just from your personal perspective?
Well, I think with me, I mean, we've obviously known each other for a very long time, and I have a very like science brain. So I was always in school. I was always so interested in like the details, like studies about how it improves blood pressure, and then I would like go down a rabbit hole for 2 months and be totally focused on that.
Hmm.
And I would tell everyone about that WebMD and how one adjustment, like scientifically, is equivalent to 2 blood pressure medicines, right?
Yep.
And then other times I would be like, oh my gosh, did you see the study on the immune system? It boosts the immune system by, 200%. And so it was like, I feel like in school and probably the first few years after school, it was very much like each individual situation that came in, chiropractic was for that
Right.
almost. You know what I
Right.
mean?
Yeah.
Whereas now it's like looking at the big picture of like, how does a simple or well, it's simple, but complex adjustment make such a huge change in our bodies
Yeah.
from like a neurological standpoint? Because I do feel like everything from cancer to autoimmune to anxiety, depression, all of that is really a dysregulation of the nervous system. We're like
100%.
spending so much time stuck in that fight or flight. And when you get an adjustment, it's like a light switch is being flipped on and off, and like your entire body has been reset.
Yeah.
And for each person, it's going to be a complete different level of just powerful potential that is now flowing through their body.
Yeah.
And it is different. I mean, obviously we have the honor of adjusting hundreds of people every day. And if you were in my shoes and you got to hear all of it, it's like an adjustment does everything. It
Yeah.
truly has the power to impact every single aspect, every diagnosis. I'm not going to sit here and say like one adjustment is going to cure whatever you have, but it's going to help.
It's
And I
always
believe
going to be
that
beneficial. Yeah.
wholeheartedly. Yes, like life is always better after an adjustment.
Yeah, that's our new favorite tagline, right? Because I mean, it's true. I mean, for you and I know, we've been adjusted for so long. I mean, it's pretty rare that I come to you or you come to me. I mean, it happens, but it's very rare that like you're like, oh, hey, like I really need an adjustment because I'm hurting here. Like, I mean, yeah, it happens, right? But like usually it's just like I just know I need an adjustment. I feel fine, but like I know things are going to be better afterwards, and they always are. And I think kind of how I really like just in the last like probably year and just like thinking about my own life and my own health, I've really been like ultra focused on really the impact of stress in our lives and the stress in our bodies, and how we really don't have much of a defense for that. Like, meaning you can't make it's tough to make stress go away in your life, right? I mean, you can't do most of us can't do anything about civilians being killed in Israel and in the Gaza Strip. We can't do anything about the Ukraine, war. We can't do anything about the economy or politics or inflation, right? We can't do anything about those things. So because we can't do much about it, our bodies are subjected to the stressors that is put upon us, right? And our only defense is the health of our nervous system and how efficiently it can take in that stressful information and essentially like diffuse it or dissipate it, and that only happens through a healthy functioning nervous system. So it's even why, I mean, we have hundreds and hundreds of patients that come in on a weekly basis or every two, and be like, "How you doing today?" And they're like, "I'm doing great." And my response to that is, "Awesome, the perfect day to get it. It's the perfect day, perfect reason then to get adjusted." And then I usually add in, you must have some good chiropractors, with that too. But really kind of moving beyond, I mean, yeah, obviously we're here to help conditions that, symptoms, and we want to help people with that. But really, I think my goal is to help shift people beyond this, like, I have a pain, it hurts here.
Yes.
So therefore, that's why I need an adjustment versus I'm a human being living in 2023. I have stress in my life. I want to live the best life that I can. I want to get the most out of my life. So therefore, because my nervous system is what controls everything, I live my whole life through that. That's why I get adjusted, because even if you got adjusted and pain, it didn't help with pain, there would still be benefits to your life and your overall health and human experience because of the impact, right, on all of that. So yeah,
And
that's
not
my
in
little
that
rant.
moment, not just in that moment too. Like,
Exactly.
the saying that, chiropractic adds years to life and life to years. That's so true.
Hmm. I'll never forget one of the things that I was in my first internship that I was working at. There was a patient who had been a 20-year crack addict, 20-year crack addict, and struggled with rehab, never got really any results with that, but she was sort of taken on as a pro bono case, if you will, in this clinic that I was working at. And by golly, like after I can't remember, it was like 3 or 4 or 5 months of care, of the only change it made in her life was adjustments. She completely got off her drug addiction, from that. And that's not to say that every single person that has a drug addiction, they get adjusted, like they're all going to be fixed. But it tells me that that for me really highlighted the nervous system has such a more profound, and chiropractic therefore has such a more profound impact on our lives and our health, more so than just like, oh, it hurts in my left hip. And again, this not to downplay your guys' needs if you have those, and how we want to do it, because we do want to serve you that way. But I think it's more so we just wanted to help see the bigger picture of everything too, not just like the kind of the day in and day out things.
Yeah, 100%.
Awesome. And we could go into like kids and children and the benefits there too, but I think we can probably save that for a different episode, just to talk about, the benefits for young people and kids, to get
Pregnancy,
adjusted to, right? Yeah,
most definitely.
exactly. So the third thing is obviously it's the vibration, which the technical term for that is called neuromuscular reeducation. It's a fancy way of saying like we're retraining your nervous system and your body to hold a new desirable, right, state or position. Um, so I'll give a little bit of backstory on where how the vibration therapy made its way into chiropractic. So basically, what happened is that this goes back to like the 70s and the 80s, and the Russians were doing research and they were looking for ways to help. I guess they call them cosmonauts, to not lose bone and muscle mass when they spent long times in space. Because everybody knows you go up in space, you don't have resistance, you don't have gravity, so you atrophy, you shrink. And so what they were able to find was that there were certain vibrational frequencies that if their space, their cosmonauts were, exposed to on a regular basis, that they didn't lose as much muscle and bone mass, even spending months and months and months, in a zero gravity environment. And so some really smart people about 20 years ago really figured out a way to find the right frequency to incorporate that in with chiropractic, and really postural control, postural improvement, and then even then. So since then, I mean, there's still very few clinics in the country that incorporate that, but I feel that it's one of our kind of secret sauces, if you will, that really separates us from other types of chiropractors, where you hear like the knock, if you will, that like, oh, once you go to a chiropractor you always have to go back, which actually that gives me an idea for an episode. We should do all the the dumb one-liners that people have about chiropractic, and kind of break them down. But aside from that, that is one of the goals of why we have you sound the vibration after the adjustment, is that we're trying to make gradual, consistent correction in your spine. And that really helps us, so that while we may be working on the same area for a long time in the same way to try to make a change, eventually we should see gradual improvement in that, or substantial improvement of that, with an x-ray too. So do you have anything you want to add about the vibe? I know you like to use it a lot for kids and moms, or parents and things like that too.
Yeah, for sure. I think just on like a basic level, vibration, just vibration therapy. I mean, you can see it in gyms now. You see it at PT offices. Just when
Osteoporosis
out, wait,
clinics, right?
yes,
Yeah.
yes. It's like Yes, scoliosis clinics. It's all about the health benefits of it, which is profound, right? It helps with immunity, it helps with weight loss, it helps boost your metabolism, it increases cardiovascular flow, it increases lymph flow, which and therefore has so many direct effects on your body. So every time you stand on the vibration plate, you're getting this whole multitude of health benefits. But then when you start adding on the weights, you're actually increasing that proprioception from your feet all the way up to your brain and truly changing your posture post adjustment. So in the perfect position. So it is really powerful. And
Yeah.
people are always like, can I just skip vibration? I'm like, well, you're skipping an integral part of this step.
Right. I mean,
Like, yeah, of course
and I would
you
say
can skip
you
it.
can do whatever you want, but like you said, you're missing a vital component. And remember, this whole call was, Zoom is like to help you guys get the most out of your care. So obviously you can not do wobble. You could choose to stop getting adjusted, right? Or you could skip any one of the three steps, right, and get less out of your care. And that's your choice. It's your body. It's your health. To do that. But I'm always like, well, if you're here, if you're paying something, like why not get the absolute kind of most out of it, that you can too. So yeah, I mean, I've even had the benefits are so far reaching with the vibration too. I've even had patients buy their own to use at home because they're really that beneficial, um, to use. And like the world is kind of waking up, to that too. So yeah, just I think in conclusion, it's like the wobble is important, which is why we have you do it, right? The adjustment is important, which is why we tell you to do that for the rest of your life. The vibration is important because that's why we tell you to do it after every single, adjustment, because even if your spine is near perfect, right? Well, it's a helpful way to help it stay, kind of stay that way too. So the last thing I wanted to go over just again about how to get like the most out of your care here too is I really feel like, and sometimes I kind of bang my head against the wall too, but like I realize that some of this may be it's like certain patients might need like a permission slip, if you will, to utilize us. But I feel like we get really underutilized, literally as your doctor who sees you far more frequently than any other doctor in your life. I don't care how bad your health is. Like we definitely see you more. And it's not to say that we're the cure all, fix all, and can solve every single one of your problems. But I think part of this was just to give you guys as our patients a permission slip to like utilize us to the fullest capacity possible, because we will also be the first to tell you if we're not the right person to answer that question for you. But if so, I know I'll speak for you, that like if we'll find the answer, like, or we'll find the person who will find the answer, if it's not us. But I think for me, like one of the most frustrating things about being a doctor who really invests like a lot of time and emotional energy into our patients is to have someone under our care that's frustrated with their care and then like not speaking up about it or not like asking questions that like hey, is there more that you can do, or is there more that I can do, right, in order to kind of get the best results for your care here. So I think just don't be you can add whatever you want to do. Is I'm just saying don't be a bump on the log in terms of your care. I mean, this is your life. I mean, you only get one body, and so you might as well get the most out of it, right? And by doing so, use the people that are in front of you as health experts to the greatest ability possible that you can. I don't care if it's something little. You're like, well, you've been struggling with this little teeny skin thing. I may not know the answer. You may not know the answer, right? But like, instead of just being frustrated about it or thinking you're going to have it for the rest of your life, why not at least ask somebody, right?
Yeah, for sure. Just communicate. Lines of
Communicate.
communication are always open.
We are here. All right. So good. Well, let's wrap this up for today. We love feedback. So if you guys, we're kind of, the show will be sort of an ongoing process that we'll do. I think, like I said, we'll kind of get some ideas as we go for fun things to do and to cover here in the office. But have a great day.